Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob. Phenomenal questions, tremendous. Somebody was told that they needed levothyroxine, which is for low thyroid, and want to know my opinion. Basically, in our practice, we follow the numbers. We treat with specific non-medication nutrients to support the TSH, T3, and T4. That's pretty much the bottom line. We follow the numbers. We don't just indiscriminately throw the dice when it comes to nutrient. There was a mom that contacted me. She has a young son. I think it was about a year-old child. They're involved in a motor vehicle or some type of an injury. When the baby went to the hospital with her, they found gallstones, and she really wanted to know. Had somebody else call our office today with the same thing. I'm not trying to diagnose anybody, especially with a one-year-old child. I would suggest peppermint leaf from Gaia Herbs, and I also would suggest some phosphatidylcholine. Because the child's so young, I may make a recommendation. You might want to contact me, and or you want to find a chiropractic pediatric specialist, which Dr. Anthony and Dr. Kaysen, who work in the office, they do that. Someone wanted to remove the age in the legs. I wasn't sure what that meant. I personally take a liquid protein every day. I exercise every day. I don't know if you had varicose veins or not. The liver is a real key for varicose veins and spider veins. Being active really would help tone those muscles up and making sure that you have some protein. Somebody wants to know why their lower legs swell when they're on prednisone. I can tell you that the prednisone is going to it's going to throw off everything in your body. Swelling in your body, it's going to affect your kidneys, If you're on a prednisone, you're going to have some sad, bad effects. I don't know why you're on the prednisone. If it's for pain, you want to get off of sugar and fruit. Someone was taking Iodine, about 50 milligrams a day, which I think is really too much. I would encourage you to get a urine iodine loading test, and you treat accordingly. 50 milligrams of any iodine every day might not be too much for you. Before you go to that level, you really want to do the urine iodine loading test. Someone wanted to know what organs in the body are affected by halides and when you take iodine. So bromine, fluorine, and chlorine are the halides that are impacted when you use iodine. Skin rash, metal taste in your mouth, and nausea are the common body signals if you have toxicity in bromine, fluorine, and chlorine. Someone wanted to know about what should they do if they're on steroids and losing minerals. I would encourage you to have a mineral tissue hair analysis. The hair analysis will tell you a lot. Somebody was having some challenge with diuretics, and they were having swelling in their legs, and they wanted to know what to do. Well, we have found that swelling oftentimes in the legs is heart or kidney. Might not have enough minerals, might not have enough protein. I would encourage you to bounce on a ball. In our practice, we use a tool called the acoustic cardiogram that helps us determine heart function. It's a nutritional snapshot. It's not a diagnostic tool, but it's a nutritional snapshot to see what's going on inside of your body. Anytime you have swelling, think of heart and you think of kidneys. What do gray color eyes mean? Well, in my iridology class that I took many years ago with my doctor of natural health, they really didn't talk too much about gray. Mostly yellow around the pupil, which could be kidney, and sometimes some brown could be gallbladder. I did look it up for you, and it just said people who have gray eyes, it tends to be a little bit more of a calming effect. So that would be your answer. What's cloudy urine after using the castor oil pack? I'm sure that your body is dumping toxins, possibly. I'd bounce on a ball, by the way. Get a lot of questions about dry eyes. The sympathetic nervous system helps speed the body up and it dries your body. But we also have noticed that not enough iodine could be a reason that you have dry eyes. And then either the same person or somebody else want to know about tearing eyes. I want you to know when I ride my bike early in the morning sometimes and it's cool outside, my eyes will tear up. And I'm sure it's just your body's natural response to that environment. Someone wants to know about eating tomato seeds. You know what? I basically eat all kinds of seeds. I don't eat the pit of an avocado, and I don't eat plum seeds. But I can't imagine tomato seeds are going to create distress. I'd rather have you eat a tomato with seeds than a genetically altered tomato without seeds. How's that for an answer? Someone wants to know, how should you sleep? When the blood flows back into your heart, it comes up this way. So you're better off to sleep laying on your right side so the blood flows back in without creating distress to your heart. When you lay on your left side, the blood can flow back into your heart too fast. Last question. What about silver? I've had this question asked before. This one is silver sol. I know it's colloidal silver. I don't know enough about silver. I know a lot of people use silver. They have great results with it. If you've been using it, you have great results. That's awesome. If you would like and you have a chronic infection in your body, stay away from sugar. This is Dr. Bob DeMaria with another episode of Ask Dr. Bob.